Good afternoon, everybody. Thank you for joining us today. We are going to be going over the community health needs assessment for the Central Region. Next slide, please. Thank you. So I'm just going to briefly go over the agenda for today. We will be introducing the Maricopa County Department of Public Health team. We will go through the community health needs assessment overview, and then we will dive into some data topics that may be of particular interest to those of you who are on the call. And then afterwards, we're going to discuss the next steps that the county will take based off of the needs assessment. And then we do have some objectives that we're hoping to accomplish in our time together. So we do want to make sure that everybody has a good understanding of the CHNA process. So we'll be watching a short video clip that was produced during the 2023 Community Health Needs Assessment. And we will also identify some Community Health Needs Assessment findings that are specific to the Central Region. And then we'll go through and share a little bit about accessing and sharing the Maricopa County Department of Public Health community health data, which means that hopefully you'll be using it for your programming, policies, and potentially grant writing if that's up your alley. And then we will also be talking a little bit about how to participate in addressing the priority areas that were identified through the Community Health Improvement Plan, which we refer to as the CHIP. And then we will also go through how you can support the 2026 Community Health Needs Assessment cycle, which will be coming pretty soon. And then we do have some housekeeping items to keep in mind. If you do have any questions, please feel free to add them to the Zoom chat. And you can address those to either Jessica Francis or Maricopa Health Matters. Those are the two colleagues that I have with me today. And then at the end, we will have an evaluation survey that just gives you an opportunity to give us some feedback. This is the first time public health liaisons are providing this type of presentation. So we do definitely want your feedback so that we can improve for the next round. And then we will be providing the slides for the presentation, as well as the recording of this presentation within the next couple of weeks. So please expect that in your email. So some of you may be wondering where your public health liaison is, and that's actually Alejandra. Next slide, please. Thank you. So Alejandra is actually at a conference this week, so that's why she's not with us. And I'm Alexandra Oropesa. I'm the Senior Public Health Liaison for all of the 5 regions across Maricopa County, so I'm stepping in to support Alejandra. But for those of you who don't know Ale, she does have a master's degree in healthcare administration management from the University of Phoenix. And she's actually been with public health for well over 10 years. So she's a seasoned public health advocate and professional. But she recently joined the Public Health Liaison Office covering the Central Region in January of 2024. Next slide, please. Thank you. So for the public health region for Central, we have the cities and towns of Phoenix, Laveen, and then Maricopa County, the portion of Anthem, which is unincorporated Maricopa County. And you can see it on this map here, surrounded by the other 4 regions. And there's almost 2 million residents across all 3 of those areas. So it's actually our largest region when we compare it to the rest of the regions, because there is such a high level of Maricopa County residents living in that region. Next slide, please. For this next section for the CHNA overview, the video does describe the CHNA process and the impact that it has on the community. And then we will go through and identify the community health needs assessment findings that are specific to the Central Region. Jessica, can you play our video, please?
What does health look like in your community? Join us as we explore the health and well-being of residents of Maricopa County through our upcoming Community Health Needs Assessment Survey, launching in March 2023. Maricopa County Department of Public Health strives to create a healthy, thriving Maricopa County for all by listening to what's important to the community and engaging people in meaningful ways. To do this, we collaborate with healthcare systems and community partners to conduct a Community Health Needs Assessment, also known as a CHNA, every 3 years. By working with community partners, we have increased the level of resident input we collect over the last 10 years. When more residents reflecting the diversity of Maricopa County take the survey, you can better identify and address the issues that people in our community care the most about. What has CHNA data shown us so far? For the last CHNA, we conducted 2 community surveys, one standard survey in 2019 and a supplemental survey in 2021 about the impacts of the COVID-19 pandemic. Across these 2 surveys, the community identified the following priority areas. These top priority areas also emerged in stories shared by the community. Here's one story shared by a community member regarding their physical and mental health impact.
So where does this data go after it's collected? The CHNA data has sparked action to accomplish the following. Share data with at least 7 major hospitals and healthcare providers to inform new approaches to serve the community. Center community voices to inform decision-making for program and policy development. Direct funding to local community organizations to address top community needs such as mental health, access to care, and social determinants of health. And inform the CHIP developed by over 100 community partners who form the Health Improvement Partnership of Maricopa County. The CHIP is a long-term systemic effort to address health needs based on results from the CHNA. What else can promote well-being and health equity? We look to community members to tell us in the upcoming CHNA launching in March 2023. As a leader in Maricopa County, your partnership is key to that success. Our collective efforts to promote the survey among our networks, both virtually and in person, will help ensure that we capture the most representative community data. We hope that our collaboration will provide strong opportunities for Maricopa County residents to achieve lifelong health. Visit maricopahealthmatters.org to explore past survey results, complete the CHNA interest form, and become a CHNA champion today.
Thank you, Jessica. So on this slide here, you can see that there was quite a bit of representation from a variety of residents out in Maricopa County and within the central region. In early 2023 is when we really started engaging all of our partners, such as yourselves and additional individuals and organizations in the community. And we did that because historically we had collected surveys in the community, but what we were really wanting to do this past cycle, and we do it in all cycles, but this was, I would say, our highest number of representative responses since we started collecting these surveys. So we had over 18,000 responses, and what we really wanted to do was reflect the diversity of Maricopa County. As you all know, Maricopa County is very diverse, and so this approach really allowed us to do that. You can see that for the central region, we were able to capture a little over 6,000 or almost 7,000 surveys. And so this also meant that we partnered with a lot of different organizations, such as veterans, individuals either living with disabilities or organizations that serve individuals living with disabilities, as well as organizations and individuals that identify as LGBTQIA+, and then the refugee, immigrant, and migrant community. Next slide, please. So this slide here really goes through the growth that we had from 2021 to 2023. We did have some cities, not outside of, or some regions, I'm sorry, outside of Central, who really had some growth, specifically looking at Southwest, Northeast, and Southeast. Phoenix historically has always reached the 250 mark for number of surveys completed, which is the requirement to obtain a city profile. But you can see that just in terms of responses from all of Maricopa County, we did have growth, and we're really proud and excited for that. Now, on this slide here, we tried to capture the variety of community champions. And so here you can see we have the nonprofits, school systems, family support services, really just a really large variety of partners out in the community. And because we did have so many different partners working on this project, we were also able to put out some RFPs, and we had 23 community partners that assisted us in gathering survey responses from underrepresented groups. One out of 4 surveys was actually captured by one of those partners that had an RFP from us. And so we definitely do see the value in incentivizing our partners so that we can make sure that we're getting the voices of those underrepresented groups. Now, in the city of Phoenix, again, outside of those RFP partners, we internally within public health spent a lot of our time having meetings and discussions around how we could really get into a variety of spaces out in the community. And so here we have listed some of the keys to success. We developed a comprehensive communications plan, and the video that you all just watched is actually a part of that communications plan. We definitely had some clear participation goals, and then we had weekly meetings that allowed us to take a look at what zip codes, what cities, what regions were really reflected in the data, and then it gave us an opportunity to pivot if there was any spaces where we maybe weren't seeing very many surveys being completed. So that was one of the things that I think was really impactful. And then mobilizing not only public health staff, but volunteers and attending a variety of events. So here in these pictures, you can see that we were at the Phoenix Zoo during Children's Day, and then we were at a couple of different libraries. So there's definitely a mixture of spaces where we were tabling and events that we were going to. And this is just in addition to the events that all of you all were hosting, because I know that some of you on the line were requesting surveys and encouraging your employees or your programs to encourage the community to take the survey. And so that was another key to success. Now, around the data collection events that I was describing, we did have some major accomplishments. We spent about 18 weeks collecting data out in the community. We had 68 staff and volunteers, and then we attended 187 community events. So in total, we had about 1,300 hours of time at events, which I think is, again, just one of the ways that we were able to ensure that we were meeting the community where they live, work, and play. And then we did also have some funding set aside for giveaway kits. So some of you may remember we had some salad cups, we had some safety kits, and then we had some heat relief kits that we were providing to individuals who were taking the survey. And they seem to be pretty popular, especially the salad cups or cereal cups if you don't like salad. Okay, so now I'm going to hand it over to Jessica, and she will go through the survey results, which is what you are all here for. Thank you, Jessica.
Thank you so much, Alexandra. Is everyone able to hear me okay?
Yes.
Thank you. So, hello, my name is Jessica. I am the Community Health Assessment Coordinator here at Maricopa County Public Health, and I will be walking everyone through the CHNA survey results. So, As Alexandra mentioned earlier, a lot of this data and completing community health needs assessment wouldn't be possible without our community partners. We were only able to collect such representative data due to our partners. So in this section, going over the results, I'm going to be going over how our partners can also access and share this community health data for use in programming, policies, and grant writing. We're excited to be able to share results not just for the county and regional level, but also for different cities from each region. So we are going to be going through the background of how we collected this data. And Liam, who is operating as Maricopa Health Matters, she'll be dropping links in the chat as I'm going over these different sources. So as a reminder at this time, if anyone has any questions as we go through this presentation, please send a chat to myself, to Alexandra, or to Liam at Maricopa Health Matters, and we'll make sure to address it by the end of the roadshow if we don't address it here in this presentation. So starting with a little bit of background on data collection over the years, this graph here shows that we conducted our first community health needs assessment in 2012. At the top, you can see we had 973 or about 1,000 participants in our very first cycle. And that was after offering the survey in a paper format in both English and Spanish. And so throughout the years, you can see we were able to provide additional survey features that helped allow for better outreach. So over the years, we obtained more funding and we increased our staffing so that by 2017, we were able to start providing mini grants to our community partners who were helping us conduct that targeted survey outreach. By 2019, we started providing the survey virtually, and we were also using a regionalized approach so that we could include more voices than just those who reside in the Phoenix metropolitan area. And then by 2021, we started offering the survey in additional languages that are commonly spoken in Maricopa County after English and Spanish. And that's what resulted in us being able to collect in 2023 more than 18,000 survey responses. So going into the methodology of all the data that contributes to the overall community health needs assessment, the CHNA survey, what's also called the community survey, is actually one part of the overall community health needs assessment. So for this presentation, that is the data we're going to focus on today, as the community survey allows us to get the most amount of information from across the county, but we also have other methods of collecting data from residents. So through focus groups and key informant interviews, we can learn more about the lived experience of residents and get a more holistic picture of various factors that impact one's health. So this past cycle, we contracted with a vendor to conduct 40 focus groups, and we were able to recruit 366 residents to hear about their lived experiences. We also worked with another county vendor for our key informant interviews, and we were able to conduct interviews with 24 community leaders who come from various sectors such as business, government, healthcare, law enforcement, and faith-based organizations, so that we were able to understand their unique perspectives on policies and systems that can influence the health of our residents. So as I said, for the rest of this presentation, we are going to be focusing on the CHNA survey data, but for anyone who's interested in reading more about what our residents and our key informant leaders had to say about the health status of our community, you can check out our reports, our focus group report and our key informant report on maricopahealthmatters.org, which you can also access by scanning the QR code on the screen. So before we dive straight into the data, I want to make sure that we're all on the same page about how we interpret the data, as many of us viewing this roadshow may have different levels of experience with data interpretation. So the format of the data slides that we're going to be looking at moving forward are going to be very similar to what you see here on the screen. At the top of the screen, you are going to see a question that we asked the residents. So in this example, the question is, how would you rate your physical health? And we'll also review the answer choices that residents had. So they could have rated their health as good, fair, or poor. And the results that we'll be presenting on each slide, those percentages in the blue bars, will be representing the percentage of participants who chose one of the answer choices listed above. So for this example, we are reviewing the percentage of participants who rated their health as poor. The first bar that you see at the top will be the percentage of overall survey respondents who selected a specific answer to the question we're reviewing. So in this example, that first bar at the top that says 8% overall, it's a visualization of the percentage of all survey participants who took the survey and rated their health as poor. And so to reiterate, one of the main benefits to collecting a large amount of representative data is being able to break out the data by subgroups. So when we look deeper into the data and we analyze responses by different demographics, such as race or ethnicity, age, gender, income, or focus population, we're able to see how the different ratings of poor health differ between various groups. So we looked for the top 3 groups that had the highest percentage of people who rated their health as poor. And as you can see on this example, we had those who identified as disabled, those who identified as unhoused, and those who reported making an income of less than $15,000 had the highest percentage of respondents rating their health as poor. So as a reminder, these percentages, they're not a breakout of that 8% overall. We looked at each group separately and analyzed of the amount of participants who identified as disabled, what percentage of them rated their health as poor. Another way that you can interpret this data is over 1 in 4 disabled participants and 1 in 5 unhoused participants reported poor physical health when compared to 1 in 12 overall survey participants. And a way to interpret this data to make it more actionable is disabled and unhoused respondents report the highest rates of poor health and may benefit from additional support and resources. So when we have data broken out by categories such as age and gender, and they're not shown on the screen here, but we do have it available in our CHNA survey report, again, on maricopahealthmatters.org. But for the rest of this presentation, we're going to be focusing on mainly the top groups that had the highest responses to each of the survey question answers that we're looking at, in order to highlight the greatest needs or assets that residents identified either at the county level or at the central region level. At this time, I just want to double check, Alexandra or Liam, did we get any questions on data interpretation, any of the information that we went over?
I do not see any questions in the chat on my end.
Perfect. In that case, thank you. We'll dive right into the results then. So the data that we're going to be reviewing on the following slides are all available online, again, at maricopahealthmatters.org. So you can click on the link that will be provided in the chat, or you can scan the QR code on the screen to access the data profile for the central region of Maricopa County. Again, as a reminder, please feel free to send questions in the chat to myself, to Alexandra, or to Maricopa Health Matters throughout this next section. And if we don't end up addressing it, again, we'll make sure to answer your question at the very end. So for the central region, we had a wonderful 6,961 participants take the survey. The results that you see here on the slide are comparing the most recent U.S. Census demographic data from 2022, which is in light blue, to the CHNA survey demographic data that was collected in 2023, which is in the dark blue. So looking, for example, at the demographic data for American Indian or Alaska Native residents, you can see that 2% of residents living in the central region identify as American Indian or Alaska Native. And after we finished surveying the central region, we found that 6% of our total central region participants identified as American Indian or Alaska Native. So when we collect more data for any group, we have a much larger sample size that helps reduce our margin of error, and it makes it easier to detect and compare health differences among different groups. The demographic results for the CHNA survey are much higher this year for every group when compared to previous CHNAs, even for our groups that, as you can see on the screen, are underrepresented when compared to census data. We use convenience sampling or reaching out to residents who are available the days that we're surveying out in the community. So we're only able to reach out to survey residents who pass by us during those events. So each cycle, we're trying to work with more and more community partners who work throughout the valley. That way we can have all of our results for each of our demographic groups be as close to representative as possible. So now that you have an idea of the demographic makeup of the central region, let's look into some of the results from our 2023 CHNA survey. The first question we're looking at here is which health issues have the most impact on you and or the people you live with or care for? When we compare the overall county results to the central region, we see the 5 same health issues rose to the top: anxiety, depression, high blood pressure, chronic pain, and diabetes. We had roughly 20 health issues that residents could choose from, and participants were also able to write in an answer as well. So if you're interested in seeing what other health issues rose to the top, I definitely recommend checking out the 2023 Community Survey Report on our website again, maricopahealthmatters.org, to see those other issues. The next question we asked was, how would you rate these assets in your community? And we provided them 20 different assets to rate, as well again as a write-in option. Residents had the ability to rate these assets as very good, fair, poor, or not applicable. So on this slide, we are looking at the assets that were most rated or had the highest rating of poor. So in both Maricopa County and the Central Region, residents rated access to affordable housing and the ability to communicate with local leadership as poor. While access to quality public transportation was rated as one of the top 3 poor assets for the county, in the Central Region, we see that access to quality and affordable childcare, highlighted on the screen in red, was in the top 3 poorly rated assets. We also looked at which assets were rated very good or the most highly rated assets. For both Maricopa County and the Central Region, assets that were in the top 3 were the opportunity to participate in religious, spiritual, or cultural events, as well as feeling safe in your home. So at the county level, while access to parks and green spaces was one of the highest rated assets, with 1 and 2 participants reporting that, for the Central Region, we actually had access to high-speed internet as part of the top 3 assets for the region. We asked residents to rate their physical health. How would you rate your physical health in the past 12 months? And they had the option of good, fair, or poor. On this slide, we are reviewing the percentage of all participants that rated their health as poor, and which 3 top subgroups had the highest percentage of respondents rate their health as poor. So looking at the county level results, they should look familiar because we reviewed them when we were going over that data interpretation slide. The results at the county and Central Region levels look very similar. It's 8% of overall respondents in both the county and Central Region level reported having poor physical health. But when we look at the subgroups, the top subgroups, we can see a little bit of differences. So for the Central Region, it was also participants who identified as disabled or unhoused, but the 3rd top subgroup was those who identified as homebound. A similar question we asked was, how would you rate your mental health in the past 12 months? And again, participants could respond good, fair, poor. Looking at those who responded, rated their health as poor, we see that the overall percentages for those who rated poor mental health is similar at the county and Central Region level, with 10% at the county level and 11% at the overall level. But looking at the subgroups, we are seeing some more differences. So at the county level, the top 3 subgroups who had the highest percentage of respondents reporting poor health were those who identified as unhoused or LGBTQ+, and those who reported being between the ages of 12 and 18. But looking at the Central Region, we see that it was the top 3 groups were those who identified as homebound or disabled, as well as those who identified as LGBTQ+. Residents were asked how often they could get medical care in the past 12 months, with options being always, sometimes, never, and not applicable. So we looked at residents who reported difficulty getting medical care, which we defined as participants who responded sometimes or never to this question. At the county level, we had 1 in 3 participants report having difficulty getting medical care. And we can see a little slightly higher rate at the Central Region, where we had 2 in 5 participants report difficulty getting medical care. The top subgroups at the county and regional levels were those who identified as Native Hawaiian and Pacific Islander, or those who identified as a refugee, immigrant, or migrant. While unhoused individuals were in the top 3 subgroups who had difficulty getting medical care at the county level, we see that those who identified as Asian were in the top 3 for the Central Region. A similar question we asked was, in the past 12 months, how often could you get medical care when you need it? Here we see a higher percentage of participants reporting difficulty with getting medical care, with 1 in every 2 participants at both the county and the regional level reporting difficulty in getting medical care. The top subgroups at both levels who reported difficulty in getting mental health care were those who identified as Native Hawaiian and Pacific Islander, as refugee, an immigrant, or migrant, and those who identified as Asian. We're able to address issues in our community more effectively when we work with the community rather than individually deciding on our own what solutions might address these issues, health issues in our community. So we also made sure to ask residents what would help them get the care that they need. The top results were similar at both the county and regional level. We saw that respondents reported having evening or weekend appointments, having lower out-of-pocket costs for services, and having more appointments available in general would help them access the healthcare that they need. So we know that many organizations are working on addressing the substance use crisis in Maricopa County. So we wanted to provide some quotes from residents on their thoughts on this topic. The quotes on this slide are actually from our 2023 focus group report. They are insightful but wordy, so I will be briefly summarizing them. But for those who would like to read more, you can access the 2023 focus group on our website again, which you may have memorized by now, maricopahealthmatters.org. So the first quote on the left is from a youth from a low-income focus group, and they conveyed that a reason why youth turn to substance use is due to a variety of variables, including lack of access to mental health care, such as therapists, or lack of education on how to manage their mental health, and instead turning to substance use to manage their mental health instead. The quote in the top right corner of the screen is from a youth in a Native American focus group who suggested that more attention needs to be given to Native American youth who turn to using substance use. And the quote in the bottom right corner is from a participant in our general youth focus group. They mentioned that they notice a lot of substance use in their school. However, they think that the solution, rather than just punishing students, is also to provide them resources and help them understand how they can stop using substances. Many residents provided their thoughts on substance use by also answering the last open-ended question on our CHNA survey, which was what additional thoughts and experiences would you like to share about the health of yourself or your community? We do currently have about 4,000 open-ended responses, and we are still analyzing it. Those results should be ready by spring 2025. But for this presentation, we just wanted to pull some quotes from Central Region residents so that you could see what participants had to say for the Central Region about substance use. So the quote on the left here is from a resident of Maryvale who feels that the city seems to be neglected as they are noticing more young people walking around the town who are using substances. They believe that to address this issue, homelessness and mental health issues need to be addressed as well. The quote in the top right state that people in South and West Phoenix are struggling and they need more access to food and housing in addition to assistance for addressing substance use. And then in the bottom right corner, we see a quote that was originally in Spanish, and it was translated that a solution to addressing the substance use crisis is providing more workshops on how to use Narcan in youngsters who overdose, and making sure that community members, specifically Latin American community members, are able to speak up about the basic needs that they need in their community to address this issue. So that was a lot of data that we just went over in a short amount of time, and it can be very hard to remember all these key takeaways that we discussed. So I just wanted to reiterate one last time, if you visit maricopahealthmatters.org, there you are able to look at the survey profiles and download them for the county level, the 5 public health regions, as well as 15 cities and towns that had at least over 250 participants. To do a deeper dive into the reports that we didn't check out, such as our key informant interview, our focus group, and some more quantitative data like our population level data, you can check out those reports. Those are all different data sources that again contribute to the overall community health needs assessment and give us a more holistic picture of health in our community. If after reviewing all these resources, the profiles, the reports, if you still don't see some of the data that you need, you are able to put in a data request at the website in the top right corner. We'll also be dropping it in the chat. This is where you can reach out to our epidemiology team about what data that you need, and they should be able to get back to you in at least 2 weeks from your request. If you would like to learn more about the CHNA survey or even potentially become a partner for the upcoming 2026 CHNA cycle, we would love to have you. You can reach out to your PDHL, Alejandra, or you can reach out directly to us at Maricopa Health Matters at maricopa.gov. If you have any more technical questions about any of these reports or results that we went over today. So we have all this data now, and we're making it more available for the community, but where do we go from here? We do want to make sure that once we collect this data that we're not just taking from the community, that we're also giving back. So we want to be able to equip all of you with how you can participate in addressing these CHNA priorities in conjunction with us through the Community Health Improvement Plan, as well as, again, how you can get more involved in the upcoming 2026 CHNA cycle. So the Community Health Improvement Plan, it is completed every 3 years in accordance with the CHNA cycle. While it is a requirement for the Public Health Accreditation Board to get that accreditation, it's more important because it creates a plan to address the top health issues that rise to the top of our community health needs assessment. So with that data, through the CHIP, we're able to set priorities, coordinate and target resources, and define coordinated actions that can be taken by community members and organizations to promote health. So what are the top 5 priorities that we saw rise to the top? Our 2024 to 2026 Maricopa County CHIP priorities are mental health, access to healthcare, access to healthy food, substance use, and housing and homelessness. So these are the top 5 priorities that we reviewed with over 100+ partners at our quarterly partner meeting through the Health Improvement Partnership of Maricopa County back in June. This is the order that they rose to the top. And we would love to take a minute or two here for participants to even weigh in on these priorities. Are any of these priorities that any of our participants today here in this roadshow are seeing in their organizations or the communities they serve? And while we're waiting for those responses, I also just wanted to mention as well, heat and transportation were also within the top 10 priorities that we saw rise to the top. Alexandra, Leham, are we seeing any comments come in?
I don't see any comments on my end, no.
Looks like we do have a comment. Definitely access to healthy food.
Awesome. We'll continue on with the presentation, but we'd love to hear more from those who are attending today if any of these issues really resound with you, and also how you can get more involved with addressing these issues that you're seeing in your communities. So, as we said, our quarterly partner meeting in September, or we had a quarterly partner meeting after the June one in September to kick off work on addressing these priorities. So at this meeting in September 4th, we went more in depth on the data that we had on each of these top 5 priorities, and we broke up into groups to discuss how we want to start on addressing each of these priorities. So we talked about what's already happening in each area, what's the most urgent need in each area, and if there's any more data we want to see related on these issues. Oh, so sorry. Skipped ahead there. So on October 9th and October 23rd, we already had 2 of our subcommittee meetings. This is where we have individuals who are more interested in being part of the planning and potentially even being part of the action team to implement these goals to address each of these priorities, come together and discuss more in detail, essentially have a more concentrated and specialized September 4th QPM, but on each of these priority areas. And we are having another one coming up on November 20th. So far, these subcommittee meetings have been about actualizing and finalizing realistic goals that we can address as each of these priority areas, such as access to mental health or substance use. Not only are they very broad, a lot of these are also overlapping. So we would love if anyone would like to attend and they're interested in seeing how they can address these issues or potentially how they can get involved. You can scan the QR code to register, and we'll also be providing a link in the chat. By attending this meeting, you are not committing or signing yourself up to anything, but you are letting us know that you're interested, and we'll make sure that we reach out to you to let you know more at our December 4th meeting, where we're going to be going over all the final goals that have been decided for each of the priority areas. So to join more, to learn more about the CHIP and how you can join, you can visit our website, hipmc.org. If you would like to learn more about how you can join the CHIP, or if you want more details on what that looks like, you can contact the team at hipmc@maricopa.gov. And then most importantly, we do recommend subscribing to our newsletter for more updates. This will let you know as soon as registration comes out for the subcommittee meetings. Just a reminder to sign up for them, as well as when the December meeting will come out. And so what we would also love is our HIPMC, they're not only in charge of coordinating the CHIP, but they also have partners who sign up to be part of the Health Improvement Partnership of Maricopa County. And so if you'd like to learn more about the benefits of joining the Health Improvement Partnership of Maricopa County, again, you can reach out to this team. But just as a reminder, you do not have to sign a formal agreement or officially join the partnership in order to be involved in the CHIP work. So we would love if you could share this information with anyone in your network who would be interested in joining this work. Again, HIPMC partners and CHIP partners are the drivers that help move the needle with creating and implementing this CHIP. So with that, we do want to hear from you. I will be passing it back to Alexandra to open up the floor for discussion, for any questions we may want to answer, and then also recapping why we'd love for you to take our evaluation form.
Thank you, Jessica. That was a wonderful presentation. So we do have a few minutes left in our hour together, and I know we had a little bit of feedback in the chat. Does anybody have any questions, comments about the presentation that we just watched Jessica present?
Hi, everyone. Good afternoon. This is Yanitza with the City of Phoenix Office of Public Health. Thanks, Jessica, for your presentation, and Alexandra as well. I know we've been long awaiting this information, and it's great to see that there are city level profiles as well as general regional profiles too. My question was, I was able to pop up the city profile at the moment, and wondering if we can also request. I notice it's very high level, so if we had any, I guess, special requests to include additional responses and items that might have been identified as priorities for the city, could that be possible as well to that data request, or are these profiles pretty limited to what was put together so far?
Jessica, you're muted.
Apology there. Thank you, Alexandra. So for certain issues or for specific demographic groups, we may have information for more than for others. So I definitely recommend putting in a request with our epidemiology team at that link to find out what information is available.
Okay, thank you.
Does anybody have any other questions? I don't see any on my end in the chat. Liam, do you see any questions on your end?
Yes, we have a question in the chat. How did you gather data from the unhoused population?
Do you want to take it, or would you like me to take it?
I was gonna say, I know that, I mean, I'm sure Alexandra, you've worked with a lot more organizations. All that I was gonna say is, I know from the county side with like public health staff, we did reach out to organizations like AZ Send and see if we could partner with them to send staff there to survey residents who identify as unhoused. But I'm sure, Alexandra, you might have some more specific examples of partnerships we had to reach out to that population.
So some of the RFP partners that we contracted with, they described that they had a history of working well with individuals who identified as unhoused. So some of the responses were captured there. And then through public health, we actually have other funding sources, other programs that also interact with individuals who are experiencing homelessness. And so some of the responses that we gathered were through our own public health programs who are normally just out there functioning for the community. So I think it came in a variety of ways. Did you see any other questions, Liam?
Not right.
Okay. Well, I know there is a ton of data. There's a ton of information on our website, but there is a dashboard that is going to be published in the coming months. And Jessica, I think you have a little more insight than I do on that, but that'll that will bring some additional information to the community. Is that correct?
Yes, it'll definitely provide a little bit more data on specifically the top 5 priority issues, and it'll be a nice summary that you can share either with residents who use your services, or even when discussing like program making or policy making. It's just the dashboard is like one place where all the different reports are very neatly summarized, and they can help guide you with which report you might want to go to if you're looking for specific information. Oh, and something I wanted to know as well in regards to that first question about where to find additional information on specific groups, I definitely recommend checking out the community survey report. We do have a little bit more data on different groups, and we look at different intersections, such as like age and gender and reported income. That is available through our community survey report. So I would double check that report first before reaching out to the EPI team to see what additional data is available that wasn't presented here in this presentation.
And I will say, for those of you who are already used to and familiar working with Alejandra, your public health liaison, if you're unsure if the data is already available on our website, feel free to just send her an email, or you can reach out to me. She's going to be out for a few weeks. So if you want to reach out to one of us first, we're happy to do a little bit of digging before you submit that request, because I would hate for you to submit a request, wait the time frame, and then EPI say, well, that was on our website the whole time. So feel free to reach out in that way. My contact information is in the chat. And I will just put a plug in for the CHIP side of things. I think the Community Health Improvement Plan is really where a lot of the magic happens after we've collected the data. So if you yourself are not in a space to on being a part of one of those work groups or attending those meetings from time to time, please feel free to share it with your coworkers or your network, because we never know who does have the bandwidth and who has really great innovative ideas to move the needle in the right direction. And we really do need those individuals to step up and participate in whatever capacity they're able to, because we recognize everybody has a day job that they have to be at too. So if we don't have any other questions, can we move on to the QR code for the survey?
Yes.
Awesome. So if I could just encourage everybody to take the survey and give us your honest feedback. We would love to hear your thoughts, your comments, ways that you think we can improve for the next round. And the link is also in the chat, if that's easier for you.
Yes, now that we've collected this data, we really want organizations to be able to use this data to help you. So any feedback that you give us on how we can do these presentations better or what you would like to see will help us provide the community what they need.
Well, thank you so much, everybody, for attending. We greatly appreciate your time and investment in the community in whatever way you contribute. We greatly appreciate that. And I think we can wrap up our session a little bit early, if that's okay with you, Jessica.
That works. Thank you so much, everyone, for attending.
Thank you. Have a great Monday.